My name's Kristin and I'm a National Institute for Health and Care Research funded academic clinical fellow in general practice. I'm also a consultant nephrologist by background, and I have the privilege of being one of the integrated care leads for the UK Kidney Association. In addition to that, I'm one of the associate co-directors of the Southampton Academy of Research. Well, as you can imagine from the different roles I hold, every day is quite different. I start my week on a Monday with a busy clinical day in general practice, seeing patients, doing home visits, helping with admin, and generally just managing what's often one of the busiest points of our general practice week. On a Tuesday, I have an academic day, and that's for my research, which is really looking at how we can better manage chronic kidney disease in the primary care setting by identifying kidney disease early and making sure everyone gets access to appropriate evidence-based management. On Wednesday, I'll often have a clinical session in the morning and sometimes a GP education session with my peers. This covers not just clinical training, but other aspects of the job, and the chance to catch up, problem solve and discuss difficult and complex cases. And I really value that opportunity to network with colleagues and learn from senior GPs. On a Thursday, I work for the Southampton Academy of Research, and we support career development and capability and capacity development for early and mid-career researchers across the University Hospital Partnership here in Southampton. And that includes all healthcare researchers across not just medicine, but also healthcare professions and healthcare scientists. As part of that, I lead a research leadership programme here in the Trust. On Thursdays, I usually start my day with a kidney flavour where I have sprint group meetings for an integrated care board-led project in partnership with our industry sponsors, Boehringer Ingelheim, and that's seeking to improve care for patients in primary care in collaboration with our secondary care colleagues across the patch. So I often start with a kidney flavour, even on a Thursday. And then I run my week off on a Friday with a kidney clinic in the morning, seeing lots of different patients, liaising with colleagues, and then in the afternoon, hopefully have a little bit of time to catch up on the admin from the week before it's into the weekend. So the most exciting part of my job, I think, is the variability. I love being able to meet people across the spectrum and really think about the impact of navigating a healthcare journey for people at all stages and how we can actually implement things that can really support people. I love interacting with people and getting to know them, finding out holistically what makes them tick. And I think that's one of the things that I find most rewarding in general practice, that we're really thinking, as we are in nephrology, about the person and what's around them, what challenges are they facing, and how can we support them not just with their physical health, but also with lifestyle, with education, with communication, with networking, and just with all the things that impact upon them in the situation that they find themselves in on a day-to-day basis. And I'm always excited when we're able to work collaboratively together at system level, in partnership to improve the care we give to patients. And for me, that's not just the hospital, the community trust, and also primary care, but also industry sponsors. And I've got a real passion for clinical research and integrating clinical research into those areas. Aside from keeping all the plates spinning and all the balls in the air, I think it's when there are systematic issues that get in the way of patients receiving the best care that they can, and where this leads to inequity in care. I think that's really hard, and I think we really all need to work together to minimise those inconsistencies and inequities, so that everybody can have access to optimal care. I think that's a difficult thing. I hope to do more research in the future, have a little bit more capacity to do that perhaps.